It's 11 a.m. here in Seoul. I'm Yoon Jung-min at the Arirang News Center. We're breaking into our regular programming to bring you a live coverage from the South Korean health authorities on the coronavirus outbreak. In just a few moments, we will cut into the briefing at Sejong Government Complex with simultaneous interpretation in English. Today, Kim Gang-nip, overall coordinator of the Central Disaster and Safety Countermeasure Headquarters, will be sharing the latest figures and updates on the COVID-19 situation in Korea. Let's go over to the briefing room as they are about to start.
The briefing today will be carried out by Mr. Kim Gang-nip, and we are also joined by Mr. Son Young-lee, Lee Kang-ho, Park Jong-hyun as well. And we have sign language translation available. First of all, here is Mr. Kim Gang-nip with the explanation on the COVID-19 response. Let us now begin our regular briefing for July 3rd, Friday. As of today midnight, we have 52 new local infections and 11 new imported cases. And as of today midnight, the total number of confirmed cases now stands at 12,967. Of them, 926 people are in quarantine undergoing treatment. There were no additional fatalities, and the death toll remains unchanged at 282. This morning, KCC held a meeting presided over by Prime Minister Chung Se-kyun at the Gwangju City Hall, where local transmission is increasing to occur. And he mentioned his support for the plans to help the city tackle the outbreak. And he also touched upon the increase of the imported cases. And he also stressed that we are witnessing a spread of sporadic infections and local infections from the metropolitan area now spreading to other regions of the country. And he said that we need to refrain from going to places that are vulnerable to infections. And he urged the public to also help practice quarantine protocols. And yesterday, we had 52 new local infections. And as for the May 6th plan to convert to live quarantine measures, this is the fifth such day to have our daily increase go over 50. And we have 23 infections in the non-metropolitan area, and thus we are witnessing continued infections in the non-metropolitan area, including the Gyeongbuk region and also Honam and Daegu as well. And looking at the characteristics of the transmissions, they are spreading. And we are not witnessing a sporadic increase and a rapid increase. This is thanks to the fast tracing of the contact authorities, as well as the public's help to curb the further spread of the virus within the community. Nevertheless, we are still witnessing cluster infections centering around small group meetings and small public use facilities. And we are also seeing these sporadic infections spread throughout regions. In particular, most of the cases are beyond the government's quarantine boundaries, and they also did not keep to the necessary quarantine measures. And we see that repeated outbreak is continuing to occur among teens. And if these are continued, we believe that it will be a situation for us to curb the situation in a difficult condition. We are seeing increasing infections in Daegu, Daejeon, and Gwangju regions, so we ask the residents there to actively partake in our quarantine measures, and please refrain from going to small gatherings as well as public multi-use facilities, and please stay vigilant at all times. Please please wear face masks, please keep distancing and wash your hands and disinfect your hands on a regular basis. And as for the Gwangju's increase of the cases, here are some updates on our support plans for the city. In order to curb the further spread of the outbreak in Gwangju area, we will make sure that we will cooperate with the local government. And as of July 1st, we have about 81.8% of the medical capacity available at the infectious disease hospitals, and the intensive care units are already at full capacity. Therefore, we will be securing 41 intensive care hospital beds at other nearby regions, and the patients will be sent to these facilities. Moreover, as for those with mild symptoms, they will be sent to the Life Treatment Center at Cheonan, and they will be administered at that specific facility. And we will continue to carry out epidemiological investigations, and we will also provide personnel for such work, and we will be dispatching 9 people there to help the city deal with the increase of the outbreak. And also, we will also dispatch 7 more medical practitioners there to help cope with the virus. And also, we will increase the number of volunteer workers for the care units as well, and about 4 people will be mobilized. And we will also swiftly give and supply about 3,000 face masks to the city. And in order to proactively support Gwangju City's decision to switch to level 2 of distancing measures, we will postpone the opening of all of the public-run multi-use facilities. However, the public servants entry screening test to be scheduled on 10th of July will be carried out as planned. And we will also continue to plan close coordination with the 3 nearby provinces and deal with the outbreak in a swift manner. Next, we will have also tighter control over the imported cases, and this comes as the imported cases is on the rise. And we will be monitoring closely the trends of these entrants, and we will have an analysis of the country's levels of risks, and they will be renewed every 2 weeks. And the pan-government teams will be making decisions, and they will have discussions, and they will designate these countries for 3 categories. And this not only carries out the areas of quarantine, but it also will take the areas of social economic measures as well as foreign affairs. And here are some updates on the quarantine measures. And right now we have put in place live quarantine measures for 41 facilities. And we have carried out on-site inspections and a lot of propaganda to help these guidelines be spread to the public. And also we cooperated with other ministries to devise more detailed plans and protocols for 11 facilities, and they include expos, festivals, as well as multi-use facilities like dormitories. Together, we also have quarantine measures to limit the consumption of food at saunas and spas, and we also will include the quarantine measures put in place at the religious facilities. And the these 52 updated guidelines will be shared with the rest of the government ministries. And going forward, we will continue to work closely with the central government to carry out a close on-site inspection. So we ask the public as well as the managers of these facilities to strictly comply with our protocols. During the weekend, we ask the religious facilities to postpone your gatherings, and we believe that many of the public are planning to go outside for social gatherings. As for places of worship, we have been witnessing an increase in the number of cases among the small religious group meetings, so please switch to non-face-to-face alternatives, and please refrain from engaging in activities that increase the droplets to travel in air. And especially we ask for the citizens in Gwangju City to take precautions. And in Gwangju City, the cluster infections that started at a religious facility spread through office-tel as well as other multi-use facilities like door-to-door sales. And so we ask the residents of Gwangju City to refrain from going outdoors to curb the further spread of the local infections. Please remember that decreasing the minimizing your physical contact with others is the best way to prevent the disease. And as for the other cities, we will be closely cooperating with the local governments to swiftly trace the confirmed patients, and we will exert our full efforts to this end. Thank you very much.
That was Kim Gang-il, Vice Health Minister, who just updated us on the COVID-19 situation in South Korea. As we heard, there were 63 new cases today, bringing the total to 12,967. There were no new additional deaths. That wraps up our coverage of the briefing this morning. Thank you for staying with us. We will be back with our regular newscast at 12 p.m. Korea time. Goodbye.